Audio Jungle.
A warm welcome to another Doctor to You Health Mastery series. Doctor to You is an online medical consultation service that can assist you with a variety of medical conditions. But the purpose of these Health Mastery series is purely informational and educational, and it's to give you that confidence to approach your physician in the discussion of your medical condition with the comfort that you have, the level of understanding to ensure that you can engage and have a fruitful discussion that will result in an optimal management plan and an outcome for you. I do just have to state that what you'll hear about today is general advice and shouldn't be taken as management advice for your particular condition. If you've got anything that you'd like to discuss, please go and speak to your physician. We at Doctor will be delighted to hear from you in a private consultation, and will assist you in the most optimal way possible. But whether that's us or your personal physician, do speak to them about your individual circumstances so you can get the management advice that's most suited for you. What I'd like to talk to you today is about asthma. Asthma is a very common condition in the population. It's a very serious condition that can cause life-threatening breathlessness at times. It's a chronic respiratory condition that's associated with inflammation of your airways and hyperresponsiveness of the airways. What do I mean by that? Now, be patient with me, but imagine this was your normal airway, nice and clean, air can go in and out without any problems at all, and you breathe normally. This is my representation of asthma, and what can happen is you get swelling and fluid that build up within the airway, and that narrows the airway. But in addition to that, it can be hyperresponsive as well. So in response to certain stimuli, certain condition, maybe fragrances, maybe a viral infection, maybe a particular allergen, something you're allergic to, it can rapidly narrow. And unless you take appropriate medication very quickly, it could lead to serious breathlessness, sometimes respiratory failure, sometimes even death if nothing is done promptly. So it's a very important condition that we're going to discuss. The course of anyone with asthma varies, in terms of its severity. Over time, some people may have just mild, moderate asthma for the whole of their life. Some people have very unstable asthma, where they can be very normal, at some particular time during the day, and can develop severe asthma attacks, later on in the day or within a couple of days of being relatively quite well. It's really, really important that you follow your asthma management advice as discussed with your doctor. We're going to go through some of those advice in the subsequent sections. Now, I want to go through some figures demonstrating the burden of asthma. Worldwide, over 300 million people have asthma, and just over 11% of these are children aged 6 to 7 years old. In the UK, over 8 million people have asthma. That's about 12% of the population. 160,000 diagnoses of asthma are made every single year, the vast majority in children. And about 60,000 people are admitted because of asthma every single year, taking up approximately 200,000 bed days. About 2 to 3% of GP consultations every year are as a result of asthma. With new diagnoses of asthma made, the vast majority of those are amongst children. Occupational asthma, that's asthma as a result of your job, is the most common occupational lung disease in the UK, representing about 9 to 15% of adults who have asthma. Now, what are some of the risk factors for asthma? We know that in childhood, asthma tends to be more common in boys as compared to girls, where by adulthood, there's actually an equal proportion of asthma amongst men and women. We also know that exposure to tobacco when you're in your mother's womb, so prenatally, can increase your risk of developing asthma. Having a family history of asthma or family history of atopic disease or atopy. Atopy is the tendency to develop allergic responses to various triggers. So that's, for example, people with conditions such as hay fever or allergic conjunctivitis, allergic rhinitis. So that's rhinitis not because of an infection, or eczema. There are a few other atopic conditions. So these conditions can increase your risk of developing asthma also. Of importance also, if a child was born premature or had low birth weight, they can have an increased risk of developing asthma. Working in the paint industry because of exposure to isocyanate chemicals, or working in a baking industry because of exposure to flour, can increase your risk of developing asthma. Another important risk factor for developing asthma is social deprivation. And this can be many things, but it's thought to be as a result of increased exposure to tobacco, living in damp environments, or having a lot of mold around, or being exposed to pollution. These are factors that can also increase your risk of developing asthma. Now let's talk about some of the symptoms of asthma. This can be one or combination of cough, breathlessness, or wheeze. This is a whistling sound, especially when you breathe out, or chest tightness. And these symptoms can vary in severity or intensity, and in frequency as well. There may be triggers for these symptoms, such as sometimes a change in weather, or developing a viral respiratory tract infection. Sometimes exercise can induce symptoms, or being exposed to cold air can induce symptoms of asthma. Symptoms of asthma can sometimes resolve spontaneously or in response to medication, and in some patients they can be without any asthma symptoms for several months or even years, whereas others may have persistent asthma symptoms or frequent bouts of asthma symptoms. Now, what's really important is recognizing features of severe asthma, because this can be life-threatening. And so if you have a severe asthma attack, you can get one or combination of all of those symptoms that I've mentioned, so cough, breathlessness, wheeze, but sometimes so severe that you're even unable to complete sentences, you're struggling, gasping for breath, and people can hear it on the other end of the phone. If this is developing and you're taking your medication and it's not helping at all, don't sit on it. Seek medical advice early. Call 999 NHS 111, or call an ambulance early, because severe life-threatening asthma can progress very, very quickly without prompt treatment. Now, how is asthma diagnosed? Well, like with a lot of things, your doctor will go through asking you various questions to help ascertain whether your symptoms are being caused by asthma or not. And often they'll be looking for, what I mentioned earlier, so wheeze, cough, breathlessness, chest tightness. Your doctor will also listen to your chest. Sometimes you can hear wheeze on auscultating your chest with a stethoscope that you yourself might not be aware of. It may sometimes be necessary to do a chest x-ray. Whilst this wouldn't necessarily confirm the diagnosis of asthma, but it would help to exclude other causes of similar symptoms. Asking whether there are specific triggers. For example, in some children, their symptoms may be triggered by a respiratory tract infection or by laughing. In adults, their symptoms may be triggered by taking non-steroidal anti-inflammatory drugs, so that's ibuprofen or Nurofen, or beta blockers, which are often used for cardiac or conditions. So that's things like atenolol or bisoprolol, and you'd recognize this if you're on any of them. Now, I mentioned earlier occupational asthma. There are certain occupations that tend to be more closely associated with occupational asthma. For example, people who work as painters, people who work in bakery, people who work in the welding industry, etc. And what you tend to observe is that when you're at work, you have these symptoms. So whether it's cough, breathlessness, wheeze, or chest tightness, they tend to be more prominent when you're at work. And then when you're away from work, for example, on holidays or over the weekend, you tend to be free of these symptoms, or they tend to be significantly less. Those are some of the features of occupational asthma.